I am a retired New York City police detective, and tonight we're going to talk about the coronavirus epidemic, pandemic here in the United States. And we're going to try to talk about some of the misconceptions and to try to have a conversation about our fears, our anxiety, and what we are to expect going in the future. If you're new to my channel, please hit the subscribe button right here is DutyRon. Hit the notification bell, give it a thumbs up. Follow me on Instagram, Facebook, and Twitter, all one word, DutyRon. Thank you so much to my channel members, my moderators, my Patreon supporters, and all of my really good friends who come on in night after night when we do go live and have great conversations. I appreciate each and every one of you. My intention for this video tonight on Friday the 13th, it's a full moon outside. We have a lot going on. Our president here in the United States has declared a national emergency. And, you know, there's a lot of people who are very nervous about what's going on, and rightfully so. I'm not a worrywart. I'm not
Thank
a
you
person
for subscribing.
I'm not a person who gets nervous quickly, but I got to say that, you know, it's the unknowns that's got all of us a little bit on edge, and rightfully so. So we're going to speak about it. Guys, please share this broadcast out onto your social media. Let's get the message out. Let's share this video onto your social platforms, and let's get as many people to come on in here and join in on the conversation. And this in no way, shape, or form is a video to create fear or put people on edge. I just want to speak about some of the facts, and we'll just go over some of the things that we have going on. We have toilet paper Armageddon going on in all of the Costco's and BJ's and your local stores. You got a lot of things going on, but I'm going to be the first to tell you, I not only work around a lot of different people who use mass transit, I also am around a lot of different people, truck drivers coming in and out of my facility. So I'm dealing with a lot of people on a regular basis. My wife and I went out to dinner tonight at a restaurant around people. I'm not living my life in fear. Again, I'm not one of the people who would fall into the category of, with special kind of conditions. I don't suffer from any COPD or any type of diabetes or anything like that, where this coronavirus is more susceptible to the elderly, to people who are having autoimmune issues and things of that nature. So we both don't fall. We're very healthy, middle-aged people, and we are going out about our regular lives, and I'm not stopping what I'm doing, and I'm not going to panic over this. I am going to take precautions. I am going to wash my hands. They're very dry. I wash them dozens and dozens of times during the course of the day. I'm really aware of touching my eyes and my face now. I don't do it anymore when I'm at work, but when I'm at home here, I'm good. But if you have health conditions and things of that nature, these are things that we all need to be concerned with. If you're suffering from, let's say, autoimmune diseases and diabetes and respiratory type illnesses and things of that nature, then you need to be concerned. And like my mother-in-law is 91 years old, 90 going on 91. If I had a cough or I wasn't feeling well, I wouldn't go near her. And she's not leaving the house. She's staying inside. She's taking the necessary precautions. She's keeping her contact limited. And, for the time being, that's the best course of action for all of us to take. I have to say, at the end of the day, healthy people will, God forbid you can contract the COVID-19, the coronavirus, and you're a healthy person, chances are you're going to let it take its course and fight it off naturally. There's no medication for it. There's no flu shot for it. You're gonna fight it off with your immune system, and in a period of time, you're going to just go about your life. So, most of the people who are relatively healthy don't have anything to worry about. It's the elderly and the people who have underlying conditions. Urban Explorer, Paul Peck Drywall, Joey Brooklyn, Karen, Stephanie, Just Believe, Tracy Taylor, Denise Perez, Evelyn Soto, all of my good friends, Dylan, Urban Explorer. I appreciate each and every one of you. Joey, Brooklyn, COPD, diabetes, cancer, compromised. Yes, yes, yes. So I'm going to just play. There's going to be no audio here, but this is going to be some descriptions from the president declaring a national emergency. This is going to be, please keep your political comments to yourself. I'm asking kindly for everyone to keep the political comments to himself. Our president of the United States declared a national emergency, and I'm going to go over with you guys because I've received a lot of emails. DutyRon, tell me what the president can and can't do during a national emergency, and it's a lot. Many previous administrations, the Obamas, the Clintons, the many presidential pasts have declared national emergencies. It's not uncommon, but it's not very common. So, other presidents have done it, and it's not the end of the world. We're not having martial law or anything like that going on. But let me just play this clip for you guys. There's going to be no audio to it. I will talk about what you guys are seeing on the screen. So let me go to that full second display. There we go. So this is from today. Actually, that was from last February when he declared national emergency for the southern border. But this is just giving you an idea what a national emergency does and what type of powers it gives. It's enacted in 1976, powers the president to take on special and temporary powers during a crisis. And when they say temporary powers, this means that he can sidestep a lot of the loopholes that are there to help intervene in a crisis situation. Let's just say examples: bailing out the airlines, bailing out some of the industries that are hit hard by this coronavirus, providing health care for people in hospitals and not having to abide by some of the loops, some of the rules that are in place for health care coverage. $50 billion was unleashed for him to and his administration to tackle this coronavirus. And I think it's a good thing. I don't think there's any need to panic. A lot of people got upset or scared over this. A few of the young ladies who work in my office said, Ron, I'm scared. Now I'm scared. And I said to them, simple response was, there's no need to be scared. This is our president taking the necessary steps to protect United States citizens. So it's not a bad thing. It's actually a good thing. So let's not get ahead of ourselves here. I am asking all of my friends and all the people here on the DutyRon family to use caution in jumping to conclusions and panic. Try to stay as calm and level-headed and educated as you can. So the president must make a formal declaration before Congress before he spends the money. So he can't just go spending it like crazy. But this was about the border wall. I'm bringing this up because he did this last February. February 13th, President enacted a state of emergency. National state of emergency. The president has 136 emergency powers delegated by Congress. So this is information that I want you guys to see and understand. 13 of those required a declaration of Congress, but the rest do not require congressional input. So this is just a little bit of a background on what goes on when a president enacts. All right, so it's going over some of the powers that allows a president to seize property, assign military forces abroad. This is if we're in a war situation. This is not applicable to fighting coronavirus, but it's just giving you Somebody asked me today, I think it was Beth, sent me a message on the Discord. She said, DutyRon, what does this mean? What does this mean? What could the president do? And these are some of the things. It's a very large act from 1976. I'll show you guys an illustration of that act, which goes over so many different things. Restricting travel, he already restricted travel. Martial law will not be in effect unless there is mass hysteria and if things get out of control with looting and things of that nature. But our National Guard will handle that on a local level, on a state level. The state police, the local police, the National Guard will all be there to prevent anything like that from going on if it comes to it. So here it says, and in a variety of ways controls the lives of American citizens. It's not, this, you could read into this and don't read into it. Basically what this is saying is that in a variety of ways, they'll control the lives of American citizens to protect you against danger. So if there's danger, there may be, instructions on what you can and can't do. But that we're not at that yet. We're not at that location. We're not at that part now. I don't think we will get to it. Basically, Shelley, hi, welcome in. Martial law is where there's no free movement. You're basically a prisoner in your own home for an extended period of time or for a short period of time. But that, I don't think we'll see that in our lifetime. I have never been around for anything like that. I don't think any of you have. Maybe maybe long time ago, but I don't recall in the recent past of any martial law being enacted in the United States. All right, let's let the rest of this go. Both Congress and Supreme Court may modify the limit or revoke the president's special powers, specifically if they deem his actions unconstitutional. So this is just here. This is just reassuring to all of us. People will say, and you might hear on the news, and you might hear some people who have distaste or disdain for the president. You might hear people say in the future or in the days to come, oh, he's going to run amok. He's going to do whatever. He's going to spend money. He's going to do this, going to do that. Congress and the Supreme Court can modify or limit or revoke the president's special powers, specifically if they deem the actions unconstitutional. So there's not going to be any type of craziness going on. Don't get sucked into that narrative. I beg you. Let's just try to stay calm, try to educate, take the opportunity. Listen, I'm not staying in my house. I'm going out. This weekend's supposed to be nice. I'm going out. I'm doing whatever I have to do. I'm not staying at home. None of us should have to stay at home unless you have some of the underlying conditions where you have some health conditions, and then it's advisable to probably just lay low for a little bit. Trump's recent national emergency declaration is expected to face major hurdles from Congress. This was from last year, so let's not. This was about the border wall down last February. But I just wanted to play this because I feel that other presidents have enacted national emergencies here. The oldest national emergency still active today was declared by President Jimmy Carter in November of 1979. So this national emergency is still active today, declared by President Jimmy Carter. So I'm not paying attention to the chat because I want to get the message across. He ordered all governments of property from Iran. Yes, I remember that. In September 2001, right after the World Trade Center attack on our nation, George W. Bush declared a national emergency against terrorism after the 9/11 attacks. So there's many other presidents who have enabled and put into effect a national state of emergency. April 2015, Barack Obama declared a national emergency to block malicious cyber threats from entering the United States. So, hello, Sweet Crazy. Good to see you. Thanks for joining. Tracy, hi. Hello, Sleeping Beauty. Hello, all my channel members, Gail, Paul Peck, Drywall. All the great ones are in here. I appreciate and respect all of you guys. Thank you for coming. Just to let you know, my son is 24 years old. He has about 6 or 8 of his friends in the backyard. They are having a little pregame and then are going to a local watering hole here. They're going to all jump in cabs and go to a local watering hole. That's the noise you hear in the background. My son and his friends, it's 60 something degrees here in New York. They're in the backyard carrying on their lives and going about their daily lives. They're going to go to a local watering hole where there'll be many other younger kids and younger adults there. And they're not, nobody's bunkered down. Nobody here is staying locked up. Hello, El Rivera. Good to see you. Nona 617. Thank you for joining. All right. So let me stop that because that's over. We'll get us back here. So again, the main focus here is that we need to, let's take the time to educate ourselves. If those of you who have underlying conditions and are restricted to their homes, and you don't want to risk getting yourself sick from contracting this coronavirus, it's advisable that you do keep your contacts limited. That's a fact. But for those of us, the washing of the hands, the staying the 6 feet distance amongst other people that you might come in contact with, limiting our public interaction, and don't go to a shopping mall if you don't have to. Like I know my wife likes to go with some of her friends, her girlfriends, or sometimes by herself, and she'll like to just go shopping at the local shopping mall where there could be 500-600 people or 150-200 people. I would say that, that's something that I wouldn't do unless I really had to do it, so let's keep our eye on the prize here. And, safety right now, because there's so many what ifs and unknowns. There's so many what ifs and unknowns that the numbers, change every day. Look, overnight in Italy, there was a ridiculous amount of deaths in Italy from the coronavirus, but Italy is not America. They're, the people, the way they live there, the healthcare is good, but it looks like, they're not really geared up for something like this. We are ready. We have many, many resources, some of the world's best hospitals here in the United States. And I really feel strongly about us taking charge of this. And, I'm not panicking. I'm not saying, oh my God, I got to get the bread and milk. I don't have hundreds of rolls of toilet paper here. I don't have any more hand sanitizer than I had in December. I'm not, I feel no need to go crazy and start stocking up on things. And those of you who are doing it, I ask you to stop. Just, do what's reasonable and what you need, and let everybody get what they need to get. And, don't panic. Panic is what gets the best of all of us. And for those of you who are outside this country, I know Gail, Australia, she's talking about Australia is also ready. Just be guided by what your, the powers that be, the people that are in charge in your state or in your country or wherever you are living, and heed the warnings. You don't need to say to yourself, oh my God, I got to wrap myself in bubble wrap and I can't go anywhere. Use your noggins, don't overthink things, but educate yourself. I take an hour or two a day to read up. I go to the CDC websites, and I'm going to show you some of the CDC websites that I recommend. I recommend the actual CDC website. It's a chock full of information. It gives you up-to-date information. I'm going to show that to you now. Here, the CDC, it's a great resource. I use it all the time with this. This is www.cdc.gov/coronavirus/2019. And here it will give you cases in the USA. Now, I'll click on the cases in the USA. This is updated today Friday, March 13th. And it says this page will be updated regularly at noon, Monday through Friday. Numbers close at 4 p.m. So this is at the numbers close at 4 p.m. It says number of cases in the United States at a glance right here. 1,629 cases in the U.S. Total deaths, 41. It might be off by a couple of numbers, 41, 42, jurisdictions reporting cases. This is the United States only. 46 states and the District of Columbia have 46 states, a total of 47, including the District of Columbia, have reported confirmed COVID-19 cases. Cases of COVID-19 reported in the U.S. by sources of exposure, travel-related, are 138. See, these numbers are really, this is good, solid information, guys. This is good, solid information. So if you go to the CDC and you can sit here for hours, here's a drop down: protect yourself and your family, and they give you illustrations. This is what DutyRon is recommending as a retired New York City police detective, as a law enforcement professional. This is what I recommend you guys go to, and not nightly news or any type of, people trying to instill fear in you here on YouTube or maybe on other social media platforms. Just, educate yourself. We're not stupid people. B Lady, thank you so much for becoming a channel member. B Lady Apiary 9992. Thank you so much. What you can do to keep yourself and your family healthy. Take everyday preventative actions to stay healthy. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. We just said that. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in a trash or in your elbow, in the elbow like that. Clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or wipes. But now if you live home and there's not strangers coming into your house, you don't have to clean every 2 seconds. Clean it a couple of times a day if you have to. Hi, Jan. Welcome in. Follow the public health advice regarding school closures, avoid crowds, and other social distancing measures. Okay, I broke the social distancing measures tonight because my wife and I went out to dinner. We went out to eat, and there was only 8 people in the restaurant, and they were spaced out far away from us. Like there was a couple across the way. Nobody was close to us. So we went out to dinner because my wife said, we're not going to stop living our life, and I agreed with her. I'm sorry I missed Joey Brooklyn's broadcast, but everyone go check out Joey Brooklyn. He did a wonderful broadcast, a very informative broadcast on coronavirus tonight. Here's some resources for protecting your health. Protect your health. What to do if you're sick, preparing your family. Here's some of the drop downs. I love this website. I recommend it. Preparing your health, yourself, your family, and your community. Protect yourself and your community from getting and spreading respiratory illnesses like coronavirus 2019. Everyone has a role to play in getting ready and staying healthy. Here's what you can do to properly prepare your family in case of COVID-19 spreads to your community. Know where to find local information on COVID-19 and local trends, COVID-19 cases. Know the signs and symptoms and what to do if you're symptomatic. And you can click right on signs and symptoms, and boom, here's your signs and symptoms. The following symptoms may occur 2 to 14 days after exposure: a fever, a cough, shortness of breath. These are the 3 clear-cut signs. Purgatory Paranormal, thanks for coming in. Fever, cough, and shortness of breath. Okay, if you're developing emergency warning signs of COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, blushing lips or face, This list is not all inclusive. Please consult your medical provider. They're saying, get yourself medical attention if you have these emergency warning signs. Hey, everybody. Hey, everybody. Hey. Thank you for becoming channel member. Much love and respect to you. I hope all is well. Hey, everybody. Hey is a good friend of mine. Go and check her out. She's really cool. Nick, good to see you, Nikki. Thank you for joining. Black Rose, love and respect. All right, guys, so you get the idea. cdc.gov/coronavirus19. Get yourself familiarized with this website. If someone could put that in the link, I'm sure somebody already put that in the chat. I'll put it in the link description down below. Jack's mom, Daphne, all my channel members, love you guys. All right, I'm gonna play a local. This is local. Now, don't get mad at me that I'm catering to my home area, but this is coronavirus complete coverage from News 12 Long Island, from my area right here. So I just wanna play this one clip for you guys. Don't get pissed.
Our county executive today declared a state of emergency to help combat the spread of the coronavirus.
Our county executive,
Suffolk's executive also
for Nassau and
taking
Suffolk,
some action. News 12's
declared a state of emergency today.
Coverage.
So let's listen.
I am officially declaring a local state of emergency here in Nassau County.
With that effective now, Nassau County is in a state of emergency. Suffolk County announced the same yesterday as the number of confirmed coronavirus cases on Long Island continue to rise.
Okay, even with this going on, I went out tonight to dinner with my wife. And tomorrow I plan to go out with her again. So this is my area. This is my local county. Nassau and Suffolk is my counties. My stepmom, my father's wife, who's in her 70s, is not leaving her house. And she is so healthy. She takes line dancing. She is Tai Chi and kickboxing. She's a beast, and she's so healthy. She's not leaving her house, and I'm not telling her to go out. I'm saying, if that's what you want to do, that's okay. And she said, you could come over and visit me, but I'm not going anywhere. And I said, okay, if that's what you want to do, that's fine.
This outbreak is bad, and it's only going to get worse quickly. Don't be scared. Just be prepared. Do the smart things.
The state of emergency gives.
All right. Did anybody, I hate to keep stopping this. I'm going to play this in its entirety, but did anybody catch on to that? This is bad, and it's going to get worse. And then the next thing is this health inspector saying, don't panic. This is what the news does to us. It fucks our heads up. Is anybody with me on this? If you listen to the nightly news or this stuff, and that's why I didn't play a lot of this, these people will have you fucking shivering. And I don't like it, but this is their job. Their job is to sell views, shock and awe, drama, fear. And I feel that it's doing a disservice to our people. And that's why I'm telling you, do not get caught up in this shit. Just educate yourself on good websites like cdc.gov, the World Health Organization. If you sit and listen to this shit, and I'm playing it to point it out. So for those of you who are going to give me comments and send me emails, DutyRon, walk the walk, talk the walk. I do this for a reason. I'm not doing this to be a jerk. I'm doing this to show you guys that these fucking people are sitting up here. These are our elected officials here in the county I live in. And this woman right here that's looking at this guy is the county executive. And she allowed these jagaloons to come up there with a signer. This lady's signing over here. And I'm going to put it back so you guys can hear this shit. I'm putting it back from the beginning. And I'm not going to say another word. Just listen to this. It's 2 minutes and 49 seconds.
Emergency to help combat the spread of the coronavirus.
I'm muting
Suffolk's executive also taking some action. News 12's Jackie Lucas continues our team coverage.
I am officially declaring a local state of emergency here in Nassau County.
With that effective now, Nassau County is in a state of emergency. Suffolk County announced the same yesterday as the number of confirmed coronavirus cases on Long Island continue to rise.
This outbreak is bad, and it's only going to get worse quickly. Don't be scared. Just be prepared. Do the smart things.
The state of emergency gives Nassau County access to resources to combat coronavirus, and it also authorizes emergency funds.
I am also closing our traffic parking violations agency, TIPVA, to the public and temporarily stopping enforcement of boot and tow programs. We are also temporarily stopping eviction enforcement proceedings by the sheriff.
County Executive Laura Kern says they're also temporarily closing all county indoor leisure facilities. Some of those facilities include Pontiac Ice Rink, Mitchell Field Athletic Complex, the Cradle of Aviation Museum, Fireman's Museum, and Long Island Children's Museum. Megan Tamburino of Merrick says she's not surprised.
I think it's a good idea. I think anything possible to help stop the spread of the virus is proactive and a good idea.
Suffolk County 311, can I help you?
Over in Suffolk, County Executive Steve Ballone says they increased staffing at its 24/7 call center. Here, they are fielding calls from concerned residents about coronavirus. The Suffolk Police Department also announced new protocols to help protect first responders.
That will essentially restrict officers who will not go inside with EMS when it involves an illness unless necessary, dictated by the circumstances, and the officer is.
Let me just add that New York City, the NYPD, put a formal complaint in against New York City, the mayor of New York City, de Blasio, that their officers are not properly equipped to prevent contraction of coronavirus. They go into every aided case with FDNY EMS, and they don't have the suit and the gloves. B-Lady, please don't spam my chat with the same message over and over again. I'm asking you nicely. I appreciate you becoming a channel member and stuff like that, but I saw that same message about 6 times already, and I'm just going to ask you nicely, and I'm not going to say it again. So this is Ballone, the Suffolk County executive, and he is talking about his officers and that he's protecting them against contraction of the coronavirus. New York City is a huge police department, but they don't have the proper protection and equipment. The police officers, the men and women who are going on these aided cases. And this guy is, no worries, B-Lady, it's all good. Just asking you nicely, that's it. I don't like Cuomo, and I'm with you. I'm on the same page with you, but just when you do that in the chat, it just, it's counterproductive on my channel. And I know that you're a friend of the channel, and you're a channel member, and you're a friend of mine. Just that, I know you didn't know it, but it's a negative for my channel, and I don't want my friends to do that. I expect some of my enemies to do that. Anyways, so Steve Ballone here is talking about protecting his officers, and I'm with him on that. I like this guy for saying this. I'm going to back it up. I'm going to back it up so you guys can hear him talking about protecting his police because they have to go out on these aided cases. And
restrict officers who will not go inside with EMS when it involves an illness unless necessary, dictated by the circumstances, and the officer is called in.
Many Long Islanders are just trying to wrap their heads around all the changes.
It just worries me, the bigger agenda with all this, and the fear that everyone is walking around with. And you can't live your life in fear.
Even though it's tough and though it may create some level of disruption with our everyday lives in terms of closing many of these facilities, will be the best case to ensure that we control the community spread and the public spread.
I'm Jackie Lucas, News 12 Long Island.
Now you can see the full list of all the facilities closed throughout Nassau. Just go to our website. Those closures.
So that's what we have here in Nassau County and Suffolk County. Listen, we all have our opinions, but at the end of the day, Tracy, welcome in. Sophia Howard, good to have you. Thank you for joining. I saw a couple of Janice, thank you for joining. Kathy, joining. A couple of Joe's mom, thank you for being in here. I saw a couple of comments while we were playing that. I got to scroll back to it. Toilet paper thing, yeah, it's off the hook. I agree. I'm trying to get to Sleeping Beauty. Yeah, Sleeping Beauty. I wish you nothing but health going forward and a lot of positive vibes. I read your message and yeah, I heard about the swine flu, right? So yeah, guys, again, I'm going to say this, educate. The more we can do by looking up good, valid information and not being negative about things, try to keep a positive outlook as doom and gloom as the media wants to put this to us. We have to stay educated, and we also have to, use our common sense. I am limiting some of my exposure. In other words, I'm not going to go into a crowd if I don't have to. I'm going to work and I'm dealing with the people that I work with, which is upwards in the amount of 30 to 40 people a day that I deal with, and truckers and other random people during the course of my business. But I'm not living in fear. I'm not going to live in fear, and I recommend that none of you do that. But if you do have the underlying conditions, a compromised autoimmune system or not in great health, then stay home. Stay home as much as you can and limit your contacts. But that's not to cut yourself off from your family members or people who want to help you. You don't have to, wear masks 24/7. If someone comes over that's, wants to help you, they could do it with a distance. You keep that 6-foot distance, and somebody could be in your home who is sick, and you're not going to catch it just because the person is there. The person is coughing on you and getting the droplets. I'm going to show you a video where an infectious disease detective said, a very well-known infectious disease detective says the 3 most vulnerable places on a human body: number 1, your nose to contract coronavirus through your nostrils; number 2, your eyes; and number 3, your mouth; and number 4, your ears. Those are the 4. This is coming from an expert, and this is verified information. The number 1 contracted way is through your nostrils, then your eyes, then your mouth, then your ears. And if you touch a surface that has coronavirus on it and now start rubbing your eyes, boom, there you go. You've now contracted it by yourself, by your own actions. I told you guys earlier in this broadcast, and I'm getting ready to wrap it up, I stop touching my face. I make a mental note to myself. I don't rub my eyes. I don't rub my mouth, my nose. I keep my hands away from my face. Gina, air hug, stay healthy, stay safe. God bless. Yes, God bless. So thank you, Stephanie, for the positive comment that I made you feel better through this broadcast. And I saw that Tori Hartman went live. I missed it. I was out to dinner with my wife, so I must have missed hers, and I definitely missed Joey's broadcasts. I definitely missed Joey's, but I did share it. Don't wear a mask unless you're sick. Yeah, it's senseless. It's useless. It doesn't do anything for you. So let me get the next clip up here that I want to show you guys. Hold on. Stand by. Okay. I have the what a president can do during a state of an emergency. I don't think I want to show you that because that'll open up a lot of extra questions. I want you to just, okay, this is it. I want to show you this. This is from Al Jazeera TV. Al Jazeera is is over in Saudi Arabia-ish area. I don't even know where they're based out of, but anyways, they have some good information. Al Jazeera, believe it or not, there's some really good info on here. And they go on to talk about President Trump declaring a national emergency on the coronavirus pandemic, opening the door to providing what he said to be about $500 billion in federal aid to fight coronavirus. How the new spirit. This is good. This gives you just a timeline. The virus has killed at least 4,600 people and infected more than 126,000 worldwide, mostly in China. This was from March 12th. This is from yesterday. So these figures are going to be a little bit inflated. There'll be more than what I just read. But the World Health Organization, that's the other place. They're in Qatar. Okay. The World Health Organization, that was the second place that I said would be a good form of information, declared the global pandemic over the new coronavirus, which is causing an illness officially known as COVID-19. Yes. All right. I had a video I wanted to show you. Give me 2 seconds. I think this is it here. Hold on, kids. This is a talk about hospitals. I'll let you listen to this because I listened to this before.
On the front lines of a pandemic that promises to only get worse, America's hospitals are already straining. In hard-hit Washington State, Providence Regional Medical Center Everett has seen double-digit cases of coronavirus. The medical director worries about what's coming.
What do we do if we have a limited number of ventilators and more patients than ventilators available? What do we do if we have more patients than beds available?
Nationwide, the U.S. has just 46,000 ICU beds. But a report suggests at least 200,000 people could need ICU care, perhaps many more. Hospitals have 160,000 respirators on hand, but a pandemic like 1918 could require more than 742,000. Already, hospitals are reporting shortages of masks and protective clothing. The country's EMS system is also bracing for a surge in coronavirus calls. There are 21,000 EMS systems in the country. 60% of their calls are basic first aid. But when a patient is struggling to breathe, it becomes a priority.
The dispatcher is telling us that this patient does have a cough and does have a fever.
Every Montgomery County, Maryland fire unit now carries an infectious disease bag with masks and face shields. The department is still waiting on 5,000 professional N95 masks it ordered in January. To conserve, firefighters were today told they should use the same mask all shift.
Take them off, place them in a paper bag, reuse them for the next person during their shift.
In Korea and Italy, the military has been called in to disinfect homes and check cars. An emergency move with a global healthcare system under stress. Tom Costello, NBC News, Rockville, Maryland.
Searching for a way to help stop your cold sore? Only Abreva can get rid of it in as little as 2.5.
Okay, hi guys. Thank you, Sophia, for the $10 super chat. I'll put it towards the live walk for Thomas and for all the DutyRon family. Amy Amore, thank you so much for coming. I appreciate you being in here. Haven't seen you in a while. Haven't seen you live. I haven't seen you on your channel. I got to catch up. This is my DutyRon sign sent in by Matt Sully, another good friend of mine. Matt is instrumental in a lot of the signs that I have, the signage. And right above that, I'll show you guys, is the bistro sign. And my wife also has home is where the wine is. Home is where the wine is. So that's courtesy of Mrs. DutyRon. So again, guys, I'm trying to give you guys a sensible, common sense approach to a situation that we all don't know how much or how worse it's going to get. I will say this, it's probably going to get worse before it gets better, but it's not anything that we won't be able to get through. Generally speaking, an overwhelming majority of people who contract COVID-19, the coronavirus, survive it Out of the 146,000, I think it's 70,000 people have contracted it and survived it. Those numbers are real. These are numbers that I read before I went live. Okay, so, a high percentage of the people here in the United States and throughout the world who contract it survive it. So let's not get into that whole mode of like, oh my God, if I get coronavirus, I'm going to die. That's not true. That's not true. The U Police sign is retired for tonight, Jan, and I wanted to use the DutyRon way. And if you haven't subscribed to my channel, here it is, DutyRon, all one word, on Instagram, Facebook, and Twitter. I have a Discord group. Send me a message if you'd like to join that Discord group. It's a great group where we can let our hair down. I let my hair down in the Discord group all the time. I have a YouTube video share group on Facebook. Follow me on Facebook at DutyRon. Send me a message. Hey, I want to join the YouTube video share group. Or, hey, DutyRon, I want to join your police and crime chat group. It's got over 400 members in it. The YouTube video share group, we're approaching, I think, 600 right now. There's 600 people in the YouTube video share group. That's all good, valid people who either have YouTube channels and share their stuff, or it's viewers like you guys who can get notifications. Dawny Color, good to see you. Thank you for coming. Nanny Patty, thank you for being in here. And thank you to everybody. Hey, everybody. Hey, everybody. She's here. How's it going? How's it going? So, guys, if you're new to the live stream, if you're new to the DutyRon family, let me know where you're watching, your city, your state, or your country. And if you haven't said anything during any of my live streams, or there's a lot of people who just lurk, now's the time. Come and say hello. Greetings from Michigan. I know you, Marcy. You're not new. Good to see you, Marcy. Thank you to everyone coming in. Sleeping Beauty, I don't have the answer to that. I don't know. And I don't think there's one set answer for that. Don't panic. Everything's going to be fine. Josh Webb, great to see you from Periscope. I appreciate you being in here. Infinite Beauty, thank you for coming in. I appreciate you being in here. Inner Peas, thank you for coming. I appreciate it. John Robles, you are the man. You are the man. Kathy from Texas. Kathy, love and respect. A lot of love and respect. Hello from the Netherlands, says Jesse DV. Thank you for coming. I appreciate it. Michigan, Jackson, Michigan. Nice. Cali. Joshua's in Cali. Everyone check out Kathy and Joshua from somewhere around San Francisco. I'm not quite sure where he is from exactly, but he's in the San Francisco area. So thank you for joining. Joshua H. Hello from Alabama, Georgian. Thank you so much for being here. Scout Inquirer. Much love from Rockland County, New York. Oh, one of my neighbors. There's one of my neighbors right there. Queens, New York. I could spit at Queens. It's so close to where I am. I'm right over here by the Belmont racetrack. So right on the Queens-Nassau border. Let's see. Who else we got? Hey, everybody. Hey. Yeah, Tracy Van Bragg. Thank you so much for always being in here. Heidi. My partner is immune. I'm not even going to, that's a tongue twister, but I know what you're saying. So he doesn't leave the house, and I scrub down when I come home from venturing out. Do you scrub down in front of him, or do you do that in like an undisclosed location? Just curious. Asking for a friend. Great calm show. I appreciate it. OG, thank you so much, OG. Appreciate that. Janice, I know you've missed. I appreciate it. Thank you for coming in from California, Canada. I have been to the Belmont racetrack. It's awesome. They're going to make a hockey stadium there. The Islanders are going to play there. Ron, Howard Beach here. Excellent. There's a fellow paisanette from Howard Beach, or if it's a male, a fellow paisan. So I'm going to conclude this live stream. Again, I want everybody to understand, Western Massachusetts, says KDC. Thank you so much. Dallas, Fort Worth. My grandparents used to live in Dallas, 2118 Tosca Lane, over in Dallas. I grew up as a kid in the summers. I used to go and see my grandparents over there, my dad's parents. They're no longer with us, but love the great state of Texas. Love the great state of Texas. I'm looking at the chat, and I'm trying to just get the message forward. Let's use extreme caution. Let's not jump the gun. Let's go with the flow. And you know, at the end of the day, guys and girls, we can't control what's happening. Whatever is going to happen is going to happen. We have to have faith in our healthcare system, in the powers that be, in our local law enforcement and our healthcare professionals. And listen, God forbid I may contract the coronavirus. And if I do, I'll let you guys know. But I know this, I'm strong enough to fight it off, and I'm not afraid of it. I'm not afraid of dying. I was a New York City police officer for 20 years. I've been shot at more times than I want to say. I've been in positions where people wanted to kill me more times than I want to talk about. I've had to wrestle and put my handcuffs on murderers during the course of my time as a New York City police officer. You think I'm going to let some fucking virus scare me? No, not. I refuse. I've looked into the eyes of death. And I'm not just saying that to make you guys feel better. It's the freaking truth. So there's nothing out there that's going to make me live in fear. I fear nobody. So, well, I fear my wife a little bit. I'll be honest with you. I fear Mrs. DutyRon. But let's use extreme caution about what we say and what we do on people's live streams. Let's catch up. And somebody said something really cool in the chat before. I don't remember who it was, but they said now is a time to catch up or maybe get a new hobby or catch up on, reading something or educating yourself on something. It's now we'll have some time to do some of the things that we never were able to do because we were always on the go. If we're sitting at home and hanging out, maybe this is a time for us to get a new hobby or try to learn how to edit videos or, anything, guys, anything. Anything but doom and gloom. Stay positive. Support each other. Love your neighbors. Love your friends. Call an old friend. Chat it up with somebody who needs to chat. Pay it forward. Oh, by the way, paying it forward, I sent a $200 donation to With Arms Wide Open. My friend Danny, who has the foundation for special needs children within the police department. My friend Danny Sprague, who was assaulted in Nashville for wearing the hat that looked like the Make America Great hat, and it really wasn't. It was a Make a 50. He turned 50, and he got punched in the face in Nashville, Tennessee. Well, he was on my live stream with me, for those of you who don't know, and I made a $200 donation to his With Arms Wide Open, NYPD for special needs children. So that came from you guys. And I want to say thank you to each and every one of you who've given Super Chat, who watched my videos in full, let the ads play, shopped on my Amazon, Patreon supporters, channel members. I took all of that money and pooled it together and made a donation not just to Justina Valva, Zupko Valva, but I made a donation to With Arms Wide Open. So that's not coming just directly from me. It's coming from all of you guys. So special thank you to everyone who's given Super Chat during this broadcast, who's done it in the past, who will do it in the future, my Patreons and all the people. I have an immense amount of love and respect for you guys. I'm honored that you all want to support me, and I pay it forward to great organizations with the help and contributions from you guys. So thank you for that. Thank you. Really, from the bottom of my heart. It really means a lot to me. I hope you guys got something good out of this broadcast. And if you take one thing away from it, take away the positivity of standing up and looking and facing your fear and moving forward and not letting the fear consume you. Because at one point when I was a police officer and when I first started putting handcuffs on people and arresting people, it was scary. I was scared. I was 26 years old. But I didn't let that get the better of me. I defeated it. I defeated that fear. And I went out there every day knowing that someone could kill me because of the uniform I wear. But it didn't stop me. I remember my wife, when she came to the precinct for my very first paycheck, she came with me in the car and she was crying. And she said, you're gonna die here. You're gonna get killed here. You gotta quit. And I looked her right in the face and I said, I'm not quitting anything and I'm not dying. And here, 30 years later, I'm talking to you guys. So 30 years later, I defied the odds. And I know that all of us are going to defy coronavirus, COVID-19. We're going to make it. We're going to get through it. And we're going to do it together. All right, guys? A lot of love and respect. If you are suffering from anxiety or if you are having a hard time, feel free to leave me a comment down below. Send me an email. DM me on any of the social media outlets. As you all know, I will get back to you. It might not be immediate. If I don't immediately respond, don't take offense to it. But if you send me messages, if you send me a message, you can bet your bottom dollar that I'm going to get back to you. And there's many people here that can speak to that for me. So let's put up those strength and positive vibe emojis, and let's end it on a good note. Let's end it on a positive note, guys. Thank you, Paul Peck. Everyone go follow Paul Peck, Joey Brooklyn, all the great ones in here. Follow all the great ones, and they are great ones. Guys, thank you so much. No anxiety, says B Lady. There you go. Bam. I'll speak to you guys all soon. Have a great weekend, and I'll catch you on the next live. All right, guys? Peace and love from New York City. Thank you, guys, and good night.